Its average weight is about 340 grams in men and 255 grams in women. The left half and the right half of the heart is divided by a wall called septum. Each half, in turn, is divided into an upper chamber called the auricle and a lower chamber called the ventricle. The auricle receives blood from the veins and the ventricle pumps blood into the arteries. Heartbeats in a normal, healthy adult, the contraction and relaxation mechanism of the ventricles results in a heartbeat of about 70 to 72 per minute in males and 78 to 82 per minute in females. Functions. The functions of the heart are: I, to supply pure blood to all parts of the body, through arteries; E, to collect impure blood from organs, tissues, through veins; E, to pump impure blood into the lungs for purification, and IV, to collect pure blood from the lungs. Situated in thoracic cavity and pericardial cavity close to its front wall. Its broad base faces upward and backward. Its narrow apex faces downward, forward and slightly to the left side and rests on diaphragm, below cardiac notch of left lungs. Shape: some conical. Color: dark red. Chamber: 4, 2 auricles and 2 ventricles. Size: rocky 12x9 cms. Weight: average weight is about 300 gm in male, 250 gm in female. Heart is a hollow, muscular, somewhat conical 4-chambered force pump, enclosed in a fibrous bag. Wall of the heart is made up of cardiac muscle fiber, connective tissues and tiny body vessels. Heart is situated in the chest between the lungs. Wall of auricles are thin than wall of ventricles, because they have to push the blood to ventricles only situated close to them. Walls of ventricles are thick as they have to pump the blood quite far away. Wall of left ventricle is 3 times thicker as it has to pump the blood to complete body. Heart has 2 pumps. I, left pump, it leads oxygenated blood which is red in color. E, right pump, it leads deoxygenated blood purple in color. Blood between 2 pumps does not mix directly. However, in fetus there is an opening, so 2 pumps meet as lungs are not functioning. So fetus gets oxygen from mother but just before birth opening is closed. If the opening is not closed, then condition of blue baby is reached, and immediate surgery is required. Auricle: smaller in size and thinner muscular valves. Ventricle: larger in size and thicker muscular walls. Left ventricle pumps oxygenated blood to rest of the body. Taller the person, lower the blood pressure in adult. Male have lower blood pressure than female. In wall of ventricle, tendinous cords present. Inner wall of ventricle is raised into low muscular ridges as columnae carnii and few large muscular elevation as papillary muscles. Between ventricles interventricular septum present, bent to right side. Lumen of left ventricle is large and lumen of right ventricle is small and semilunar shape. Between auricles and ventricles a V node present. Between 2 auricles, interauricular septum present. In a marbio in it foramen ovalus aperture present, that converts into a fossa ovalus on birth time. Right auricle, in this 2 opening present pre-caval and post-caval, in rabbit 3 openings. On opening of pre-caval's eustachian valve present. Behind it coronary sinus opens on it the Basseus valve present. Right auricle opens into right ventricle. Left auricle, in this pulmonary veins open by common aperture, without valve. It brings oxygenated blood from lungs into left auricle. Right auricle SA node or pacemaker or heart of heart or node of Keith and Flack present. It is made up of cardiac muscles and stimulate heartbeat. It is connected to vagus nerve. Both auricles open into ventricles by auriculoventricular valve. In right side, it is made up of 3 flaps. I, tricuspid valve. E, lower edges of valve are fixed to papillary muscles of ventricle wall by chordae tendinae fibers. In left side it is bicuspid or mitral valve. Both valves are one way, i.e. allow blood from A to V, not vice versa.